been one of those days. It is late at night, and I'm exhausted. One of those days. And I went. It started off this morning when I got a phone call to take in a 16-year-old girl. The child had been in foster care before. She had been sexually abused before. She had a police record. She had a 7-month-old baby. And would we take her? Not the baby, just the 16-year-old girl. And she'd be a handful, we were told. Well, my wife and I prayed about it, asked a lot of questions, prayed about it some more, and then we determined that, yes, we would be happy to take her, happy to have her come to our family. Well, then I got a phone call later on that she was not coming into care, that she's going back into the same environment. That wasn't good. Then we got another phone call. Would we take a 10-year-old girl? Just for the weekend. Girl was a handful, we were told. Fourth grade, reading on a kindergarten level, lied all day long, and had been run away, and just been a challenge. So we prayed about it, asked the questions, prayed about it some more, and decided, yes, we would take her with the understanding that she would have to go into respite care for 2 days because I was going to speak at a conference in Texas. Leave on a Monday night, come back on a late Tuesday night. So we called her back and said, yes, we'd be happy to take her. And they said, oh no, well, she was going to come into care not this weekend, but on Monday. And I said, I can't take her on Monday because I'm leaving Monday night. But, Dr. DeGarmo, since you're on the phone, would you please take a 13-year-old girl and her 4-year-old sister just for the weekend, for respite? Well, my wife and I prayed about it. After all, this would be 10 children in the house. And my wife and I prayed about it and asked the questions and prayed about it some more. Called her back and said, yes, we would be happy to. Despite the fact that we would have a 1-year-old, 2-year-old, 3-year-old, 4-year-old, 4-year-old, 5-year-old, 8-year-old, 13-year-old, 15-year-old, and 16-year-old in the house. We would be happy to do it. Well, they finally came, the 13-year-old and the 4-year-old. The 13-year-old came with tears streaming down her face. Of course, she's old enough to understand what's going on, and she's traumatized. Absolutely, she should be. And the 4-year-old is off the chain, so to speak. It's late at night. They're finally in bed. And my wife and I have always been those type of foster parents where we realize that we have to be flexible because you never, ever know. As foster parents, that is a key word, flexibility. Because you don't know what happens when you wake up in that morning. You don't know how that day is going to end. You don't know if a child's going to come to you that morning, that afternoon, late at night. You don't know how long that child's going to be there. You don't know if the child that's living with you right now is going to have a visitation that day or not. You don't know about the court maybe at the beginning of the day. You don't know if that child that you've had in your house for a while is going to leave your home in the next few days. So as foster parents, there's no predictability. You have to be flexible and understanding. Because that's how it is with the system. There are no guarantees. There are no absolutes in our lives or for the lives of the children. So in order for us to truly help these children, in order for us to truly be understanding, we have to be understanding that things may come up, that things may suddenly pop up, and that's where the flexibility comes in. If you are not a flexible foster parent, I can assure you this, it's going to be a lot more difficult for you to accept those things that just spontaneously happen. For Foster Care 101, hey, I'm going to go to bed. I'm Dr. John DeGarmo.